Hello, my name is Lauren Carnes. I'll be discussing mental health and substance abuse. This comes at a very difficult time as I lost my brother-in-law to suicide last week. So I will try to get through these slides and touch base as best as I can on a few informative facts about suicide. Some surprising facts that I came across this week is that schizophrenia affects approximately 1% of the population. To be honest, I thought that would have been a higher percentage of the population that is affected by schizophrenia. Another surprising fact is theory suggests that the cause of schizophrenia may not only be from a genetic disposition, but brain damage in the fetus or viral infection in the mother during pregnancy. Another surprising fact is chemical imbalance being the underlying cause of panic disorder. I am going to research that a little more after this, but I found that to be an interesting fact. Some not surprising facts is anxiety is the most common category of mental health disorders that impacts millions of adults in America. Also, I just want to note that it affects children and adolescents as well. According to the CDC, suicide is the leading cause of death in the U.S. Is one of the leading causes of death in the U.S. In 2020, suicide was among the top 9 leading causes of death for ages 10 to 64. Half of all mental health disorders show signs before the age of 14. Some facts on mental health and substance abuse disorders I will discuss. I'm first going to discuss substance abuse disorders. I did know about overdose risks as far as the topic I'm going to discuss is when somebody has, for example, some sobriety time away from heroin, and there's a relapse that occurs and that individual goes back to using the same amount of that substance that they used to use. This tends to lead to an accidental overdose because they think their body can handle what they used to take in of that substance. What I did find interesting in some of the resources that were listed for this week is that when you use the drug in an unfamiliar setting, so if you're using the drug at certain times during the day, but you're using the drug in an unfamiliar setting or unfamiliar time, like midnight at a party, in that case, the body is not ready for that drug, and there's no physiological counterbalance to help offset the effect of the drug. When that's the case, this can lead to an overdose, even on a dose that the person has normally been taking, and that oftentimes that is what happens. Substance use disorder is a mental disorder that affects the brain and behaviors. I work with the drug courts and mental health courts in Massachusetts. And when I first started working with the drug courts, there was a lot of education I had to provide around mental health disorders co-occurring with substance abuse. Alcohol is very lipid soluble. It enters the brain easily and acts on the GABA receptors. This promotes a depressant and a pleasurable effect. Heroin has a similar action on the opioid and dopamine centers as alcohol, in which there's an increase for cross addictions. Evidence suggests that approximately 70 to 80% of those with borderline personality disorder will attempt suicide. I found that very interesting, where I researched that a little bit more. I'll just go over a few reasons why borderlines have severe emotional pain. This is very intense negative emotional experiences that someone with borderline personality disorder, I'll refer to it as BPD. Um, uh, they want to escape often. BPD is a chronic condition that usually lasts for years, and one of the most unique aspects of BPD is suicidal ideation. People with this condition may consider suicide on a daily basis, or for months, maybe even years. There's comorbidities with BPD. They tend to co-occur with other mental health disorders like bipolar, depression, or schizoaffective disorder. Impulsivity, this is associated with BPD. These individuals tend to act quickly without thinking. They may engage in suicidal behaviors in a moment of intense emotional pain without fully considering the consequences. Substance use, when substance use issues are combined with borderline personality disorder, this may be a lethal combination. Substance use can lead to even greater impulsivity. And to no surprise to me, I have a lot of interest in the brain and the limbic system. With somebody with borderline personality disorder, they have brain abnormalities. There's a reduced amount of gray matter, and they tend to have abnormalities involving brain structure. The limbic system, as we know, it helps the body respond to heightened emotions such as fear or anger. This initiates the fight or flight response. An example, the region that implicates depression and shows functional instructional abnormalities in depression, you have the amygdala, hippocampus, and the dorsomedial thalamus. I just wanted to mention, again, I have a strong interest in the limbic system. I don't want to make this too long, but my body was exposed to black mold, and I was very sick. They wanted to diagnose me in the beginning with anxiety disorder, just all those mental health, depression, and I'm a mental health nurse, so I knew how to advocate for myself. I knew something was wrong. Finally, someone gave me an MRI. Then they wanted to diagnose me with MS. One of my close friends had watched a documentary on Hurricane Katrina and knew that I had a water leak. I was starting a business, very busy, and didn't take care of that right away. And sure enough, my house was, in fact, infested with black mold in a particular area. I got into our food, our beverages, underneath the floorboards. So with that said, MRI had brain inflammation that caused a whole blood clots, you name it. A lot of things breaking down in my body. I only share that because toxins can inflame the brain and present with mental health signs and symptoms of mental health disorder. There's a really great documentary, or it's a movie, is Brain on Fire. There's a lot of articles written and just not a lot of education out there. So when you think about the limbic system, it acts as a control center for conscious and unconscious functions. It's regulating much of what the body does. In some way, it connects our mind to body, and it bridges that gap between psychological and physiological experiences. So, the blessing in disguise with all of that is just my strong interest in really, really assessing and finding out when individuals are struggling with mental health, really what the underlining problem is. Oh, geez, I wish I could talk for an hour because I have so much to say, but I'll try to cut it down here. So getting back, for example, when we activate the fight or flight response, the limbic system triggers a physical response to the emotional experiences, such as fear. But when you think about something like addiction or things that are putting our bodies and our nervous system in fight or flight constantly, there really needs to be a tool, I believe, to retrain our brains and to calm our nervous systems to heal. Um, our system, the limbic system, works well for occasional stressors. However, when the stress that we face on a daily basis, we don't really realize how the limbic system that can easily get caught up in it. They call it a destructive loop that contributes to the symptoms of the disease. So it is just continuously going in a limbic loop. This is the limbic system's dysfunction from the chronic stress response, whether that is from a mood disorder or you think about substance use or an environmental factor. It could be from stresses from a relationship or losing a loved one. These acute stressors definitely play a role. And so because of these other stressors, maybe from toxins or mood altering drugs, they can hijack the brain's reward center. And this can even be from past traumas. So my strong interest is in neuroplasticity. This allows the retraining of the limbic system to optimize its function and heal. And when that heals, we can heal our bodies. This can reduce sensitivity of the stress response. This is can also be coupled with other treatment modalities addressing the limbic loop can make a huge difference in retraining that brain. So I'm going to finish this off with, if we're incorporating these modalities, especially for substance abuse, of kind of breaking those patterns. If you think about, I'll be careful with some of my words with that, but I feel as though if we can retrain those brains and we can have some further healing. Thank you for listening.